Welcome to the Benefit Orientation Overview for the Carpenter Health Network for the plan year beginning January 1st of 2026 through December 31st of 2026. This is Don Massett of Massett Olind Benefits Consulting. Over the next few minutes, we'll be reviewing some of the upcoming changes to your benefit plans and costs for the new plan year. As a reminder, our office is available to assist you with questions regarding your benefit options, claims, prior authorization requests for medical services or prescriptions, and member ID information related to your coverage. Cheryl Irwin is your dedicated Senior Account Manager at Massett Olind. Please don't hesitate to contact our office or your HR department for assistance. Contract and policy information can be found on page 4 of this benefit guide. For current employees that are enrolled as of January 1st of 2026, open enrollment applies to the following benefits: health, dental, vision. If you're enrolled in Health Plan Option 2, you can establish a health savings account. You can enroll in a hospital indemnity plan for additional coverage. And this year for 2026, open enrollment does include the opportunity for employees to purchase guaranteed issue life insurance as well as short-term and long-term disability through the standard insurance company. This is an initial open enrollment for this year only, so that if you waived benefits previously, you will have an opportunity to purchase those benefits now for January 1 with no medical questions. First-time benefit elections or changes will take effect January 1st of 2026. Benefit elections for newly eligible employees will take effect the first of the month following 30 days of full-time employment. Newly eligible employees with an effective date for benefits of January 1st or after may elect to enroll in health, dental, vision, establishing a health savings account if you're enrolled in Option 2 health plan, hospital indemnity coverage, and you can purchase voluntary life and short-term and long-term disability through the standard on a guaranteed issue basis when you're initially hired. As a reminder, employees who wish to waive coverage for you or a family member when newly eligible or during open enrollment will not have an opportunity to enroll until the next open enrollment period, which is January 1st of 2027. If you experience a qualifying event during the plan year, you will have 30 days from the date of that event to make your elections. Now, we do list examples here on page 5 of what a qualifying event is. These are just examples, but I think everyone does know, typically in this day and time, what a qualifying event is. So if you have any questions at any time regarding that, please do not hesitate to contact our office for assistance. So this year, we are making some big changes. The Carpenter Health Network will be changing health plan administrators and pharmacy benefit managers effective January 1 of 2026. Effective January 1, the Carpenter Health Network will be moving from Blue Cross, which is the current plan administrator, to 90-degree benefits, previously IMA. 90-degree benefits was the plan administrator for the Carpenter Health Network for many years, and they've done a great job. Effective January 1, the Carpenter Health Network will be changing to a pharmacy benefit manager, Lavinity. And for the first time, if you elect to enroll in Plan 1, you will have the option to utilize the Phoenix Pharmacy, a subsidiary of the Carpenter Health Network, for further reduced cost to many of your medications. So for the health plans, the Carpenter Network will continue to offer 3 plan options. Plan 1. This plan offers a 2-tier benefit. That means if you utilize the Tier 1 side of the benefit and utilize the Verity Health Network in Louisiana, which is an HMO network, then your out-of-pocket costs are very, very low because that tier plan has no deductible, and you have a much lower out-of-pocket medical expense. You can also choose to fill medications through Phoenix Pharmacy as well. for further reduced cost. Or you can fill medications through Livinity Pharmacy Manager, which gives you access to all the name brand pharmacies such as Walgreens, CVS, Rite Aid, and so forth. The Tier 2 side of Plan 1 utilizes the Aetna National PPO network. And the plan is a more traditional PPO plan with deductibles and coinsurance. So you'll be able to choose your level of care by using either Tier 1 or Tier 2. And we'll talk more about that in just a minute. Plan 2 will continue to be the qualified high deductible plan, which allows you to contribute to a health savings account. Aetna will be the network associated with your plan, and Livinity is the pharmacy benefit manager. Now, I say Livinity, if you remember, it's Express Scripts through Blue Cross, so look at the pharmacy benefit manager much like that. Livinity is the pharmacy benefit manager, but that does not mean you cannot utilize the pharmacies that you're currently using, again, like a Rite Aid's or an Albertsons or Target or so forth. Plan 3 will continue to be the same PPO plan that is currently available, utilizing the Aetna National PPO network and the Livinity Benefit Pharmacy Manager. Now, we have removed the drug deductible starting January 1 on Plan 1 and 3. There is no longer a $250 drug deductible for Plan 1 and Plan 3 participants. And that deductible, it did apply to all covered family members. That is now no longer on your plan. The employee cost share. On Plan 1, the rates reduced in all categories. Plan 2, employee-only cost remained the same with a slight increase for the dependents. And Plan 3, the cost will increase in all categories, but the adjustment is not at all significant. We'll go over that here shortly. Implementation. All currently enrolled employees in Plans 1, 2, and 3 will be migrated over to the new plans for January 1 of 26, based on your current election. During open enrollment, if you wish to change plans, you will receive a second ID card. So we have already electronically submitted all of your current elections. So if you were in Plan 1, we have already moved you to the new Plan 1 effective January 1. You will receive a new ID card. However, during open enrollment, if you choose to go to Plan 2 or 3 or vice versa, then you'll just expect to receive a second ID card. Now, the good news is that when you do receive your ID card, your member number does not change. So if you're in Plan 1 currently and during open enrollment, you go to Plan 2, when you receive your second ID card, due to the change, your member ID number will be the same. The dental and vision plans will renew with Humana. There was a rate adjustment on the dental benefit, but it was minimal, and the rate is still very reasonable for the benefit. The vision plan will not be changing in benefit, nor was there a rate increase. Now, this year, Symetra issued a significant rate increase on voluntary life, short-term, and long-term disability. The standard has come in at a much, much lower rate adjustment. There is still a slight rate increase, but it's significantly less. So due to that increase, we're moving everyone to the standard. Now, what we're going to ask of you is when you go in for open enrollment this year, or if you're a new hire hired throughout the year, to please take time and re-elect the benefit that you've had before. If you've waived voluntary life or short and long-term disability, you now have a chance to enroll for January 1 of 2026. So all people that have waived before can now purchase it. And that is on a guaranteed issue basis with no medical questions. Now, for the short-term disability benefit, this benefit will be based on 60% of your earnings up to $2,500, and that is per week for a 13-week period. The previous benefit was only up to $1,400. Now, what is different about the short-term contract is with Symetra, you could purchase a lesser amount of coverage. for a lesser premium. That is not how this contract is written. This contract gives you 60% of your earnings up to $2,500 per week for a 13-week period. Long-term disability, you will have two choices. You can purchase a 40% of your pre-disability earnings at a lower rate, or 60%. Basically view it as a high and a low option. Previously with Symetra, you could buy down the benefit and pay a lesser rate. With the standard, we're going to give you two choices: a lesser rate for a lesser benefit, or a higher benefit for, of course, a higher premium. You will continue to have the opportunity to keep and/or enroll in the Symetra Hospital Indemnity Program, which is remaining in place with the Carpenter Network. So let's now talk about the plans. So what's exciting about option one is this plan has two sides to it, and you can choose the side that you need to consider using. If you use the Tier 1 side, you'll be utilizing the Verity Network. Now, the Verity Network is an HMO network, and it comprises of the Baton Rouge General, the Baton Rouge Clinic, Women's Hospital, the ACMC Health System, and Tulane University, just to name a few. So there is no deductible when you use the providers in the Verity Network. If you have to have a inpatient hospital admission, your only out-of-pocket cost is $1,000 per day for a 3-day period. So if you're in the hospital more than 3 days, you're covered at 100%. If you need an outpatient surgery, your copayment is $1,000. Physical therapy, $40 copayment. Also, lab work is covered at 100%, and MRIs and CAT scans are just a $500 copayment, no deductibles. Ambulance is $50, and emergency room is $900. Your doctor copayments are listed here: $20 for primary care, $45 for specialists, and $75 for urgent care. So your maximum out of pocket when you use this side of the plan is $3,000. Also, all of your out of pocket costs do aggregate to Tier 2, so that if you have to utilize Tier 2 and use a provider within the Aetna National Network, you do have a higher deductible as well as the coinsurance and a higher out-of-pocket limit. The Carpenter Health Network is letting you enjoy the savings in the network with Verity by passing along to you a very limited cost exposure health plan. So that's where the Carpenter Health Network wants you to enjoy the savings by utilizing these providers. You have a choice. If your doctor's not in the Verity Network, you can utilize your doctor if they're in the Aetna Network, which they likely are, but then when you do so, then you're going to have a higher out-of-pocket expense. I'll give you an example. Shoulder surgery. In this example, your out-of-pocket cost maximum would be $1,000, $500 for the MRI, and you'll have copayments for physical therapy, I'm certain, right? Over here, due to the deductible and the discount not being as significant with Aetna as it is with Verity, then you could expect to pay at least 2/3, if not more, of the $4,000 deductible. And then your physical therapy does come in. Once you've met your deductible, you pay 30% of the cost, and an MRI, you're required to meet the deductible before any cost share takes place. Now, under the Tier 1 benefit, you can utilize the Phoenix Pharmacy here in Louisiana, and that is a subsidiary of the Carpenter Health Network. And they're going to pass along further discounts, specifically on Tier 1 and Tier 2 medications, as well as Tier 3. You also have the choice of using the Lavinity Pharmacy, the national pharmacy. So if you take a specialty medication, that's going to be completed and filled here through Lavinity. So most of your Tier 1 and Tier 2 medications you can have filled through the Phoenix Pharmacy, and they're available for you to pick them up if you live in Baton Rouge at their location, or they'll overnight them to your home. So you now have two different tiers to choose from, but this is all one plan, Plan 1. Pick and choose which side of the plan makes the most sense once you look at the providers in the network. Plan 2 is the high deductible plan that allows you to have a health savings account, and you'll see your cost listed here below. Now, you can establish a health savings account, and you can have dollars deducted out of your check on a pre-tax basis to help pay for deductible related expenses. Now, I always mention to people that if you have a lot of chronic medical conditions and take a number of high cost medications, that we would urge you to consider looking at Plan 1, because some medications can be very, very costly. And in Plan 1, you have co-payment protections, whether you're utilizing Phoenix or Lavinity based on the medication. Also be reminded that before your prescriptions are covered, you do have to satisfy the $3,000 deductible. Now, when it comes to deductibles, if it's you and a family member, once one family member satisfies the $3,000 deductible, they're covered at 70/30 coinsurance. For Plan 1, Tier 2, once a family member meets the $4,000, they are then covered at the 70/30 coinsurance. So you don't have to meet the full family deductible before that family member is going to receive any cost share. Now, Plan 3 is the plan that's still going to stay in place, utilizing the Aetna National Network and the Lavinity Pharmacy Benefit Manager. We did remove the drug deductible, as you can see here, so you'll just pay your co-payments under each tier starting January 1. The cost increase was not significant if you want to keep this plan. You obviously have co-payments for your physicians, specialists in urgent care. You do have physical therapy at a higher copay cost here of $75 versus Plan 1, and $40 for lab and x-ray, but you do have to meet your deductible for diagnostic testing and obviously outpatient services and hospital services. Now, I do want to keep in mind that under this plan, if you considered Plan 1, you would technically have a similar Tier 2 benefit, other than the physical therapy copayment not being under this plan, or the coverage for lab and x-ray. So you technically could utilize Plan 1 and then have the option to use services based on providers in the Tier 1 side of the plan. So keep that in mind as you go through open enrollment, because you can see the cost difference per pay for an employee is $99.44 in option 1 versus the $73.30. So Plan 1 just gives you the opportunity to save dollars when it makes the most sense. Now, telehealth services are available to all states for the Carpenter Health Network employees except for Florida. Home Medica does provide telehealth services. So when you don't feel well or your child is sick, the last thing you need to do is worry about leaving home or work when someone's feeling uncomfortable and not well and sitting in a waiting room. For non-life-threatening medical conditions, you can contact Home Medica, set up a face-to-face time with a provider. This is available to you 7 days a week from 8 a.m. to 8 p.m. If you're enrolled in Plans 1 and 3, you'll be assessed a $30 copayment. That'll be deducted from your paycheck. And if you're in the high deductible Plan 2, it's a $50 copayment, and that would be deducted from your paycheck. Again, this is available in all states except for Florida. So please take advantage of the Home Medical program, yet another subsidiary of the Carpenter Health Network. So 90 Degree Benefits will be your third-party administrator, just like Blue Cross was your third-party administrator. And if your ID card is produced by 90 Degree Benefits. If you have an issue with your ID card or general customer service, 90 Degree Benefits is your customer service, but of course, so is our team here at Masset O'Lind. So please load the mobile app. This will give you access to your electronic member ID card with 90 Degree Benefits. And just a brief copy of what it's going to look like. So your ID card front and back, it'll say the Carpenter Health Network. It's going to have Lavinity listed here as the pharmacy manager. and Verity as well as Aetna. Now, remember, if you're in Plan 1, the Verity and Aetna contracts apply, but if you're in Plan 2 and 3, only the Aetna network applies. And you can obviously access these networks here to see the providers that are available to you. Again, Aetna is the national PPO network, like Blue Cross was, but Verity is Louisiana-based HMO network with great discounts when you utilize the Baton Rouge General Hospital, Baton Rouge Clinic, Women's Hospital, LCMC, and Tulane University, and more. And here's just a brief overview of the Pharmacy Benefit Manager through Lavinity. If you have any questions about medications, you can contact the pharmacy, Lavinity at the 1-800 number, and you can also load the mobile app. This is key. This way you can look up the cost of medications, what tier that they fall in, and if they require a prior authorization. Now, we did request a prior authorization file from Express Scripts so that many of you will not have to go through the pre-authorization process again with your medicine unless the time has come to re-up the prior authorization. And an overview of the Phoenix Pharmacy access online if you're in Plan 1. Once again, we want all employees that consider Plan 1 to enjoy the savings. This allows you to be your advocate. And you don't have to change a doctor that's not with Verity, but you may choose to have a procedure at a much lower cost with very good group of doctors here in the marketplace and throughout Louisiana on the Tier 1 benefit. So here you can see that generic medications are a $5 copayment. Convenient at-home delivery options are available. You can have your doctor submit your prescription to the Phoenix Pharmacy, and the instructions are listed here. And then they will contact you to make arrangements on how you want your medication sent to you, or if you wanted to pick it up at their local office here in Baton Rouge. So for Plan 1, Tier 1, this is the Verity First Choice and Health Net Network. Just review this as the Verity Health Network, Health Net Network. And this is how you look up the providers. And the doctors are going to be really in both, but technically just looking at Verity Health Net. And within the Health Net network, you'll see some doctors are in the first choice side of the network, but it's all the same network, everyone. And again, these networks have a much lower discount for services versus provider contracts with other networks. And the Carpenter Network is going to pass that savings on to you, again, on how rich and benefit the Tier 1 side is of Plan number 1. Now, if you need to look up providers in the Aetna National Network, we have some information here for you to do that as well. And again, if you have any questions, please don't hesitate to give us a call or our team at 90 Degree Benefits. If you're in Plan 2, the qualified high deductible plan, you can establish a health savings account. And for 2026, the IRS has increased the limits that you can contribute to your health savings account. Now, if you're looking to move from Plan 2 to Plan 1, for example, and you have dollars left over in your HSA account, you can use those dollars to pay for qualified medical expenses, doctor copays, prescriptions, meeting a deductible or a copayment. You can even use the dollars for dental and vision needs, such as eyeglasses, contacts, dental work, and so forth. You just can no longer contribute to the HSA if you're not in Plan 2, but you don't lose the money. So newly eligible employees or for open enrollment, you have the opportunity to enroll with Humana on the dental plan. You have no waiting periods for Type 1, Type 2, Type 3 services, or orthodontia. The annual benefit limit for you and each covered family member is $3,000, and preventative services do not count towards the $3,000. So 2 cleanings a year, if they averaged $140 each, would be $280 that do not count towards the $3,000. If you go outside of the Humana network, you can use providers. They can verify your coverage with Humana. They can file the claim with Humana as a courtesy, and then Humana will pay them accordingly based on the 90th percentile reimbursement rate. Now, in that instance, if the dentist is not in the network, they don't have to accept that payment in full, and they can balance bill you these differences. But technically, there's usually not a lot of balance bill differences because the reimbursement rate, even to a non-network dentist, is at a very high reimbursement scale. Your vision benefits through Humana offer you a $10 copayment for eye exams, $15 copay for materials, frames. You can have a $130 allowance, and you'll get a discount of 20% over $130. You also have allowances for elective contacts. We would urge everyone to take a good look at the vision program because this program is very, very affordable, and just the eye exam alone is worth $120 to $130. So this is just a great program to consider for you and your family. You can load the Humana mobile app, and this will give you, again, additional information related to your dental and vision benefits, your member ID card, as well as you can look up providers accordingly. Now, for the voluntary life insurance program, we're moving everyone to the standard. If you had voluntary life previously, we would just ask that you re-elect the benefit that you previously have. You can purchase up to $250,000 guaranteed issue with no questions asked in $10,000 increments. You can have $25,000 on your spouse and $10,000 on your children. If you want $25,000 on your spouse, you have to have at least $50,000 on yourself as an employee. If you waive this benefit as a newly eligible employee or an existing employee for this open enrollment, there will not be a future open enrollment. Now, you can purchase a lesser amount of life insurance, such as $40,000 or $50,000, and that will at least allow you to be in the plan that you can then later potentially increase that at no additional cost. Now, this coverage does come with AD&D, accidental death and dismemberment. So if it's a death due to an accident, then the beneficiary receives the face amount times 2. And so this is portable at the rates that you can purchase. So we would ask everyone to take time to revisit your beneficiary form. We do ask that you consider using someone of age as the beneficiary, just to avoid probate and court costs. But this is an opportunity for newly eligible as well as current employees to make a guaranteed issue purchase of life insurance with no questions asked. Voluntary short-term disability is available to newly eligible employees as well as current employees during this open enrollment period. You can purchase up to 60% of your pre-disability earnings. Your benefit amount is up to $2,500, paid weekly over a 13-week period. This is an exceptional benefit. If you waive the benefit for January of 26 as a current employee, or if you're a new hire, hired throughout the year, and you choose not to enroll, there will be no future open enrollment. You have an opportunity to purchase it on a guaranteed issue basis for January of 2026, and when you're eligible as a new hire. So please be careful that you don't overlook this valuable benefit. Long-term disability is through the standard now, and you'll have two choices. You can purchase a lesser amount benefit, which is 40% of your pre-disability earnings. And once qualified, you'll, after a 90-day elimination period, you'll receive that no more than $10,000 a month based on your earnings to Social Security retirement age, or if you file a claim in these age brackets here, then you'll still receive a benefit based on these benefit periods listed. You can purchase the maximum benefit, 60% of your pre-disability earnings, up to $10,000 a month after a 90-day elimination period. So you have a lower cost approach based on 40%, and then you have a higher cost, but a benefit that's going to get you the most for your money based on your needs. Now, again, just like life and short-term disability, if you waive the benefit for January of 26, or you're a new hire and do not elect to enroll when you're newly eligible, guaranteed issue will not be offered again in the future because there is no future open enrollment. Your Symetra program, hospital indemnity benefit, is also available to you. This program gives you a choice of 2 plans, and we would urge you to look at both. This gives you extra dollars if you have a hospital confinement or if you're in intensive care. The cost is listed here. It's offered on a guaranteed issue basis, and you all have a chance to purchase the benefit for open enrollment or if you're a new hire when it's made available to you. You have other additional supplemental products that are offered through Boston Mutual and Allstate. And if you have any questions about those programs, you can contact the Clements Agency listed here. Just a brief overview of the retirement plan offered by the Carpenter Health Network on page 35. The program is administered through Principal, and you will receive information when you're eligible to enroll. This is just an overview of the vesting schedule and the company's contribution and match program. Now, on a confidential basis, if you have any issues that are personal in nature, it could be depression, marital problems, it could be issues with drug and alcohol abuse, or dealing with stressful anxiety with a family member, you can contact our team through the standard. It's an employee assistant program, and you will be connected to a guidance counselor that is certified to help you through these areas in life. This is 100% confidential. This resource is available to you at no cost. And I want to reiterate, this is confidential. Neither the Carpenter Health Network nor our firm receives any communication or information related on who contacted the program and what their issue was. So we would urge you to take time to look into this, and the resources are also available here for further information. During the enrollment process, as a new hire or open enrollment, if you have any questions, don't hesitate to contact our office. And after you have finished your enrollment through EASE, you can load the EASE mobile app so you can have access to your benefit elections 24/7. Now, with this transition this year, everyone, for open enrollment, we got started a little later than we had hoped, but we had to make sure that everything was in place to make the change from Blue Cross over to 90-degree benefits and have everything put in place accordingly. Next year, open enrollment will occur sooner as it has in the past. So that concludes the orientation. Again, my name is Don Massett of Massett and Benefit Consulting. Please don't hesitate to give us a call. We are here to assist you.